So what is the solution to some of these signs and symptoms of perimenopause? Well, the first thing that I do is I take a hormone test. And I use the salivary hormone test because it lets me see hormones at the active level, okay, in the cells, at the cellular active level. If we take the hormone levels, the hormone panels with the blood, we don't get a true picture of what the hormones are doing at an active level, because most of the hormones in the blood are bound to proteins in the blood, and I can't get a true picture of what's going on with the activity of the hormone. So I take a saliva test. It's very simple. You just collect the saliva in the morning and we mill it off, and we get a wonderful panel of the levels of estradiol, progesterone, the ratio of progesterone and estrogen. That's what I'm looking at. Remember, with the estrogen and progesterone level, we're looking at that. And it also checks the adrenal glands, which sometimes are affected in perimenopause, checking the DHEA, cortisol, and testosterone. So I get about 4 or 5 pages of information and spend that time in explaining it to the individual that comes in, to allow the understanding of matching their symptoms with the test results. Most people, it's like they're elated to see that, oh, it's not really all in my head. I don't really need an antidepressant or anti-anxiety. It's just my hormones are out of balance right now, and we can do something about that. After we get the results, of course, we're going to balance that ratio of estrogen and progesterone. I do that with, I use different kinds of progesterone. It depends on a lot of different circumstances. I use progesterone serum, progesterone cream, we have troches, we have capsules. I also use a supplement that helps the liver metabolize all that extra estrogen that are causing these signs and symptoms. What does this result in? Oh my goodness. Within a month or 2, even less than that, I see a much deeper sleep. What does that do? That gives you energy during the day. So most people that were coming in with fatigue are now saying, oh, I'm sleeping so much deeper, Dr. Marcantel, I'm getting that deep sleep, and I'm waking up refreshed now. And I'm not having the mood swings as much. I even have their husbands come in and tell me, I don't know what you did with my wife, but she is feeling so much better, and so the whole household is better. So it's all good, you know, it's a good thing, and it's an easy fix, and it's getting to the root cause of what's going on during this time, the 30s and the 40s, and it can be a really simple fix. And then the other thing too that's real important here is a lot of women get hysterectomies during their 40s because the lining of their uterus, the inside lining of the uterus, is so thick that they get fibroids and they bleed a lot. And so they end up getting hysterectomies. And so because of that estrogen dominance feeding the inside, you know, making it thick in the inside of the uterus and causing fibroid growth in there. So there's a lot of women that can be saved from hysterectomies during their 40s. And so, you know, that's another big thing. Also, the rate of ablations are going up. And I'm not against ablations. That's cauterizing the inside of the uterus. But a lot of times, we're not getting to the root cause of it, which is the balance of the estrogen and progesterone. You don't have to be on hormones the rest of your life. Once we get that balance and you do a few lifestyle changes, decrease the stress in your life, do more commas in your day, like I call it, downtimes, it decreases the stress will affect the nervous system, which affects the hormones. I'll say that again. Stress will affect the nervous system, which affects the hormones and causes that imbalance. So the importance of incorporating some downtime during the day and pacing yourself during the day, putting yourself back first, is really important in your whole healing process. Keeping in mind, we work with the whole person, the physical, mental, emotional, and spiritual as well, because these are all important to promote health.